Good evening. Welcome to Northamptonshire Clinical Commissioning Group Annual General Meeting. I'm Dr Joanne Watt, I'm GP Chair, and you're all extremely welcome this afternoon. This is a meeting that's obviously taking place under COVID precautions. We will be undertaking some social distancing, so please forgive us if we're a little slower with the speakers that are coming to the lectern. We will be making sure that we maintain appropriate distancing at all time. We will have the opportunity for members of the public to submit questions, and that questions will be closing at 7 o'clock. So if you want to put questions in before 7 o'clock, you are extremely welcome to do so. We have a number of speakers, and we hope that this evening will be interesting and informative and tell you a little bit about the year that has been and that we're celebrating at this point. So my first speaker is Toby Saunders, who is Chief Exec of the Clinical Commissioning Group, who's going to give us a little bit of an overview of the year 2020 to 2021. Thank you.
Hello, my name's Toby, and just to add a very warm welcome to Joe's welcome there. This evening, by any measure and standard, is a reflection back on a year that has been remarkable for all sorts of so many ways. And in fact, the way that we're conducting this evening's annual general meeting, of course, is not the format that we're used to. We're used to being able to get together in a room and have this as a conversation with each other. So I hope that you'll kind of bear with the technology and the approach this evening, but it's great to have those of you who've been able to join us. And I do hope that you'll engage as well in submitting questions so that myself, Joe and other members of the board who are gathered here this evening are able to at least engage in a conversation, albeit a virtual one, with you. So I'm going to provide a bit of context and overview to the year that was, which was 2021, and that's the year that we're gathered here tonight to reflect back on. I will also, though, inevitably point to some of the things that bring that a little bit more up to date in terms of where we are during the course of this year. Just at the outset, a bit of context really around NHS Northamptonshire Clinical Commissioning Group, who we are and what we do. So NHS Northamptonshire Commissioning Group was actually an organisation which is only a little over a year old now. Many of you will recall joining us in previous annual general meetings in the county where you might have been joining Corby or NEN commissioning groups. Those two commissioning groups came together really on April last year, April 2022, to form a new single group for Northamptonshire covering the whole of the county. And that's the whole of our registered population of 786,000 people registered within our county with our GP member practices. And as an organisation, we're responsible for managing the budget of the NHS into the county. A budget, you put numbers down like this, they're looking incredibly large, £1.2 billion worth of NHS money that routes through our organisation during this year. When you break that down to all of those individual members of our population across the county, that's just over £1,500 per registered patient to provide for so many different care and support needs across the county. In terms of the core purpose and focus of the Clinical Commissioning Group, this slide rather simplistically summarises in three kind of steps the purpose and function that we perform. But in essence, the role of the Commissioning Group is to look at the health needs of the population, look at the service quality that's provided by a whole range of different health and care providers across the county, to work with other partner organisations, with our clinicians, with our staff, with patients and the public, to plan and fund health and care services for our population across the county. We also have a responsibility for making sure that we monitor the safety and the quality of those services, which we obviously take incredibly seriously and is a big part of our work. And we have some very specific statutory duties as well around things like safeguarding for adults and children, where we work particularly closely with our statutory partners in local authorities and the police. So the kind of core essence, if you like, of Northamptonshire Clinical Commissioning Group is the body that's here on behalf of the population we serve, that's 780,000 people, to make sure that we are planning and funding within the resources available the best quality health and care services that we can put in place for our population. And we're responsible for doing that across a very, very wide range of services for our county. And the slide here just illustrates a number of those different health and care settings where we're responsible for planning and for funding those services. That includes acute hospital services, where we fund everything from A&E services through to inpatient, outpatient services, maternity care and so on. Through community services, typically delivered in the county, many of them by Northamptonshire Health and Care Foundation Trust, in the same way that our 2 acute hospitals in the group to deliver our acute hospital services. And that includes community nursing services, a lot of our palliative care services, intermediate care services as well, both inpatient and community-based services. We have our core member GP practices, and we work really closely with them, both in the planning of services, but also the direct provision role. They play a crucial role to our population across the county, including the wider GP team in terms of practice nurses, in terms of physios, in terms of link workers. And you'll hear a lot more later on this evening from a couple of my colleagues about the way that general practice in a tremendous way has stood up and responded over the last 18 months in response to the pandemic, and how we've had to adapt our services in really unprecedented times. We're also responsible for commissioning mental health services. That includes both inpatient services that NHFT provide, but also community services, some of those crucial talking therapies, learning disability services as well. And then through to a whole range of other providers, ambulance services, NHS 111, GP out of hours services. So you can see here a really critical role for the organisation, advocating on behalf of our population and our patients, and making sure that we can plan, fund and put in place the best quality healthcare we can through a whole range of different providers to meet the needs of our population. It goes without saying that the year we're reflecting back on here has been utterly unprecedented for so many reasons, and I just wanted to start before going into a little bit detail on things that we've been doing and the role that we've played by just recognising and reflecting on the really sad and tragic loss for so many people across our county who've lost loved ones and family to COVID early and earlier than we would have expected to lose folk, and and for our staff as well, who've worked through such extraordinary circumstances in doing their best, often in really challenging situations, to support people. It's been a year, as I'll come on to, that in many respects actually has brought out some of the best of the NHS and the way we work with colleagues and partners, but it's also a year that's had huge amounts of tragic loss and an awful lot of suffering and anxiety, and that's going to be something we're living with and working through for many years and months to come. But I wanted just at the outset to acknowledge that this evening before getting into a few more of the detailed areas that I wanted to touch on. For me, the kind of hallmark, if you like, of 2021, so from April of 2020 through to April of this year, is the way that health and care partners in the widest sense have come together across Northamptonshire to do our best and to work in the best way to support our population, to support our patients. I've worked in the NHS and in local government for many years, and I can't think of a moment where it's been more obvious the interdependency and the linkages between so many different agencies working together to support our population. We'll talk later more about our response to COVID, but there are great things that we've still been able to do through this year, which have shown the way that our organisations have worked together. Things like the Health and Care Directory app, which was launched during the course of the year, which provides information on a huge range of services, health and care, access points, times, and is there 24/7 for people to be able to find their way to the services that can support them best across the county. It's also been a year where there's been a real significant number of things that we've innovated on in terms of health and care provision, and not just about the way we've responded to the pandemic that's adapted so many of our ways of working, but in terms of some of those other service changes and improvements that in many cases we've been working on for some time. Our NHS 111 First service, many of you will be familiar with the NHS 111 service. It's there for people when they need it, 24/7, often a first point of call, quite literally, for people reaching out for support in a non-urgent and emergency way. And during the course of this year, we extended the range of services there, making it easier for people who phone NHS 111 to get appointments directly booked in with a range of other services, whether that's in walk-in centres, in A&E departments, in some of our community services, in community pharmacy as well. So enabling people through one single call to have access to someone who can help to consider their needs and make sure that we can point people, and in some cases directly book people into appointments in the right part of the system for them. We also saw in March of this year the opening at Oak Tree Rise in Northampton of 7 learning disability and autism bungalows, a really tremendous piece of joint work between the NHS and local authorities that provides a supported environment for some of our population with very particular support and care needs, that's enabled to be there 24/7 but is supporting their independence and supporting them to lead as normal and as healthy lives as they are able to. And we also, during the course of the year, saw the launch of the Integrated Response Hub for Mental Health Services, which NHFT run for us in the county, together with other organisations in our mental health collaborative. And this provides, again, a 24/7 service that members of the public can directly access themselves, that can give them advice and support on a whole range of mental health and support needs. And particularly through COVID, we've seen demand for that service. It was a really timely development because, unfortunately, as a result of often the isolation and the anxiety that we've seen through the last 18 months, a lot of people have reached out directly into that service to get the support and the help they need. So just kind of 3 other examples there of ways, in addition to our wider response to COVID, that Northamptonshire Clinical Commissioning Group has been working with partners to make a real difference to the population and patients that we serve. A number of other areas that I wanted to touch on just to reflect through. Was really delighted that the Commissioning Group was recognised and awarded with the Gold Award for the Ministry of Defence Employer Recognition Scheme. It recognises the hard work over many years, actually, that a lot of our staff and some particular real champions and advocates of this within the organisation have put in, both to supporting us from an employer point of view, but also in terms of access to services and support in terms of that wider armed forces covenant. So I think real great recognition of the role that we played to support many of those folk who've given so much for their country and to all of us. We've also continued to see recognition of something we call our yellow bracelet scheme. This is quite literally what it says. It's a yellow bracelet, one of those little rubber wristbands. It's got a QR code within it. It enables people, particularly some of our elderly population and those with long-term health needs, to be able to have information about their care plan, about their medication, about their social care support needs, captured in a way that's easy to scan by other health and care professionals within the system. So whether that's an ambulance response team presenting and responding to a call, whether it's a community team, whether it's a team in an emergency department who've got someone coming into them, they're able to get quick access to the care plan and the information that those patients are presenting with. And that's enabling our frontline clinicians and professional teams to make the best choices and support for people in those moments of crisis and need. COVID, as we'll talk later on, has inevitably impacted and transformed pretty much every aspect of what we've done over the last 12 months. But from a corporate point of view, for the commissioning group, 3 kind of key areas that I wanted to touch on. 2 where we've kind of scaled things down a bit, and 1 actually where we've stepped up in terms of the things we've been doing as an organisation. From a business continuity point of view, in terms of the day-to-day running of the commissioning group, the board of the CCG and many of our management support functions as well, we did our best to kind of scale them back as much as we could. We had to keep good governance running, of course, and make sure that we're in line with our statutory duties, but we worked really hard to free up our staff to enable them to contribute to the system effort, working with local authority colleagues, with police, with fire, with the voluntary sector in so many different ways over the last 18 months. We also scaled back in line with national policy our complaints processes and actually paused that for a number of months during the core part of the pandemic last year. And in that period, we do recognise and apologise to those people who might have submitted complaints into the commissioning group, that it will have taken us a little bit longer to respond to those once we reopened that process again. I'm pleased to say we are very much back on top of that now. We've managed to work through that backlog and we are responding in a prompt way again to complaints that come into the organisation. In contrast, though, our safeguarding responsibilities, the way we work with local authorities and the police in particular to make sure that people are safe and to make sure that we're spotting early signs of risk and harm, those were things that we absolutely maintained at the same level as we ran through the last 18 months. And in a number of areas, we stepped up our work in those areas, particularly in the way that we worked with settings like care homes and others to make sure that where we had members of the population and our patients who perhaps weren't as visible to some of the other services that would often provide a support network for them, that we were able to be confident that those people were being cared for and well and safe in the county. A couple of slides I've got coming up next around performance, and again goes without saying, in a year when so many things changed, when so much of our elective work was cancelled for quite long periods of time, and when many people rightly were at home and staying at home, a lot of our activity data and performance standards do look unusual by any measure when you look back across the last year. So from a elective perspective in terms of surgery and outpatient activity, we obviously saw significant drop-offs in terms of the volume of work that we were able to do through the hospitals, through general practice in many areas. And that has resulted, as we know, kind of nationally in a real build-up in terms of waiting time positions for many different diagnostic and treatments across the county. I'm pleased to say that our teams have worked incredibly hard over the last 18 months to keep as many things running as normal. We've also worked really closely with the independent sector, hospitals that we have within the county to make use of their capacity to particularly keep going some of our cancer and more urgent surgical work as well. And I think actually we've come out of this Northamptonshire in a pretty good shape relative to some other areas that perhaps have been hit a bit harder through this. But clearly it has been a year when a lot of the normal standards and data that many of you will look at and judge us and rightly hold us to account against do look unusual for all sorts of reasons. I've touched on a couple of these areas in terms of some of the key challenges from a standards point of view. The ambulance response times in particular is something that we're now very much watching closely at a local and a regional level, as we're starting to see a lot more activity coming back into all health and care settings, right the way from general practice through to presentations at A&E departments, and what that's then generating in terms of demand for different parts of the system. And also crucially, we've continued to be able to keep running many of our mental health services through this period, in particular things like our improving access to psychological therapy services, which have really been there for people at a time of often a huge amount of anxiety and concern and a lot of social isolation and the impact that's had on people's wider health and well-being. And I'm very grateful to our teams at NHFT and to some of our voluntary and community organisations for the way they've worked together to support that kind of population group across the county. Looking forward then to the period that we're going into, coming out of the last 18 months, I mean, the first thing obviously to recognise is we are still a long way from out of this, and you can see that in the way that we're running tonight's session. Our teams are just about to gear up again for the next phase of the COVID vaccination programme as we go into the booster programme. We're continuing to roll that out across younger age groups as well, in terms of school-age children. And so there's still an awful lot of impact on the way health services are running today, which is both us doing the right thing for our staff and for our patients to make sure we keep people as safe and protected as we can. But it's also about how we prepare and make plans for the autumn and the winter we're going into, which we absolutely anticipate to be a really kind of challenging period. So we are sadly a long way from out of all of this, but due to the success of the vaccination programme and the huge efforts locally made here in Northamptonshire, particularly by our GP practices in rolling out the vaccination programme, as well as the larger vaccination centre that has been running from Moulton Park in Northampton by a range of different organisations, we are in good shape going into the winter. But I think we should all recognise and be in no doubt that we are planning and anticipating a really challenged few months ahead as we continue to deal with and live with and learn to live with COVID, as well as the seasonal pressures and challenges we expect to come through. And finally, alongside all of this, we really have been taking the opportunity in Northamptonshire, alongside the 41 other parts of the country, to look at how we can build on the way we work together collectively as a system. And we've got a colleague, Naomi, who'll be talking a little bit later on this evening with us all about integrated care system developments, which in a nutshell is about how do we kind of bottle the way we've worked in many ways for the last 18 months, different organisations coming together, focused on doing the right thing for our patients and population, and looking at how we can do that in as a joined up and seamless way as possible. So at that point, I will hand back over to our Chair, Jo, who's going to introduce our next contribution. I look forward and hopefully we'll have the opportunity to take some questions from you all later on as well. Thank you.
Thank you, Toby. First of all, I'm going to introduce Lucy Whiteman, who's Director of Public Health, as well as being part of the board of the Clinical Commissioning Group, for an initial presentation, and then I will be coming back on in a few moments.
Thank you, Jo, and welcome everybody. I'm sure I'm a relatively familiar face to many of you by now, and that's because we've had, well, quite an extraordinary year, as Toby's already alluded to. From a point of view of COVID, the first thing I'll say is clearly, you know, it's not over. We've still got a lot to do, but I think what we want to do here and now is just reflect back on what we have achieved, obviously take a moment to reflect on those as Toby's already mentioned, that we've lost, but also remind people of the work that we've done and all of the best practice that we want you to continue to execute as we come into winter. From a point of view of the main messages, well, gosh, it feels like a long time ago, but our first case of COVID in Northamptonshire was in March 2020. So it feels like a very long time ago, longer for some of us than others, perhaps. But I distinctly remember being notified, and we ended up with a family case, and you obviously hope it will be relatively limited. You hear about what's happening elsewhere in the world, in fact, not just in the country. But obviously we were at the beginning of what now feels like quite a long journey, and as I've said, it's not over yet. We have had more than 75,000 people test positive just in this county alone, and that is an extraordinary number. Around 10% of our population, but those are just those that have obviously gone and been tested, and people will remember testing wasn't freely available initially either. So, you know, this is probably just the tip of a very, very large iceberg. Of those, over 5,000 people have required hospital care. Now, some of that has been really quite significant. Some of that indeed have been our hospital providers and our clinicians themselves. It has been an extraordinarily challenging time for those that obviously have required that treatment, but also those providing treatment, and for their support and their ongoing commitment, and for putting themselves at risk to help others. We are extremely grateful. Now, sadly, obviously, people did lose their lives. We have worked tirelessly to try and make sure that the number of people hospitalised and that sadly we lost was kept to a minimum. But, you know, this is quite a significant virus. We know it is an ongoing challenge, and obviously we continue to make sure that we do all we can to mitigate that risk going forward. But it is obviously a time where we have to reflect on those that we have lost prematurely. Now, when I say, you know, what did we do in response to the pandemic, I do mean we in the sort of most general sense of the word. We have a local resilience forum, and that steps into action whenever we have a significant event. And we created a strategic coordination centre, which was actually focused here at the CCG. Now, that brought together all of the major public services, but also a number of VCSA sector partners, volunteers, and obviously we had a huge number of people to sort of step up and step out of their normal roles and take on things that were challenging and new and, you know, really, really stretched them. And again, all we can do is thank people for their commitment and for their ability to flex and grow into some of the challenging roles that were created. We had multiple cells that helped run different elements of the response, from primary care response to public protection and our gloves and getting masks out to care homes, to communications, to making sure that people obviously had all of the information that they need to be able to, and support they need to isolate at home. And that was coordinated with daily situational calls. So, you know, huge amount of work, and obviously the public played their part in this too. And that's one of the reasons that we developed a kind of an All Hands Together programme of communication. We wanted to thank everybody that was contributing, but also make sure everybody had all the information that they needed. And as part of that response, obviously not only are we coordinating and communicating, but we made sure that there were support lines, we made sure that there were also ways of volunteering, and that was coordinated through council colleagues. We set up testing centres, we had our own local test and trace service, one of the first to be established in the country. We also made sure that we had access to things like lateral flow testing, a huge number of community pharmacies, GP practices supporting the provision of those tests, and then vaccinations as well. And as I said, our residents were just brilliant. Our patients, their carers, everybody stepped up, supported their neighbours, supported their communities, and took all of those, you know, mitigating factors that we still want you to be doing to make sure that we obviously kept the virus as under control as possible. From a comms perspective, we had a number of different ideas that we took forward. We were requested that press conferences happened on a regular basis, so we made sure that those were stood up on a weekly basis alongside a surveillance report that was produced on a weekly basis. There were a number of radio interviews, both with local radio stations but also with national radio stations. We had the North Hands Together campaign, as I mentioned, and we had all of our public sector service partners involved in that. We made sure that we worked with community groups and religious groups to understand what some of the barriers were to accessing support, testing, and also making sure that people understood the benefits of vaccination. And we also, as needed, did county-wide or even very targeted leaflet drops to give people additional information about risks within their areas, how they could mitigate those, and obviously just make sure that people were as informed as possible. And as I said, we did have our challenges. So there was a sort of a very generic programme of work where we were keeping everybody informed about COVID in general. But very, very targeted challenges. We had outbreaks in particular settings. We had areas such as Corby where actually it continuously saw high levels of community transmission and was on the Chief Medical Officer's watch list for a number of months and made me lose a lot of sleep. And we made sure that we worked with the communities, with the local council as it was then, with our representatives from our GP practices in that local area, and also with obviously our residents to understand how best we could communicate the messages about keeping community transmission low, making sure that people had access to all the support they needed if they isolated, but then also making sure that they were communicating and being advocates and leading by example within their own communities as well. What we did manage to do, obviously, is get Corby off of that Chief Medical Officer's watch list, and it's obviously where we hope everywhere will stay. But we do recognise, as I said, that there are continued challenges, so we need to remain vigilant. Some of the other ways that we obviously used the local evidence about what was causing continued transmission and what the barriers were and how we could overcome them. We had some good examples, which have been put forward for awards as well, in fact, around car sharing. We found that the outbreak at Greencore, a lot of the staff were obviously sharing a car to get to and from work, making sure that they understood what best practice was around that, but also for us recognising that some people have to do that in order to be able to get to and from work. So it's not about suggesting that they shouldn't be doing it, but obviously just trying to make it as safe as possible. And working with Greencore and many of our other employees as well, who have all been extraordinary and supportive and worked with our environmental health officers and various other partners to make sure that our workplaces have remained as safe as possible, making sure again that they have all the information and, quite rightly, in all of the languages that are appropriate for that workforce. When we also talk about localised campaigns, as I said, we were one of the first areas to develop a local test and trace service working with the national programme. So if you were pinged because you needed to self-isolate, we provided you with ongoing text messages to provide you with information about how to access support, but also gave you information about how to keep yourself fit and well, how to try and avoid any social isolation issues, and also, as I've mentioned before, making sure you can get food and all of the basic things that you need, including any medication. Again, this was used as best practice and adopted in other local authority areas and with other CCGs. So I think it's a really positive reflection of the way that we've listened to our patients and our public, and we're very grateful for them coming forward and being so vocal about what works and what doesn't, so that we could make sure people got what they needed. But as I've said, we're heading into winter, and as looking forward, we need to make sure that all of that best practice isn't lost. So we know that vaccinations work. We know that most people have presented as they've been called for both their first and their second vaccination. If you haven't done either or are waiting for your second, please, as soon as you're called, come forward, and you will be getting information shortly about that booster campaign as well. Immunity wanes over time. We're starting to see that with our increased case rate. So again, once you get that booster invitation, please do attend. But obviously winter is not just about COVID, and we recognise this year, because everybody's out and about again, that we're quite likely to see an increase in flu cases. Now, we can't at this point in time give you both the flu and the COVID vaccination at once. It's quite difficult to coordinate that logistically. So again, if you get a separate call for your flu vaccination, please do find the time to go and have that jab and make sure that you're obviously doubly protected against some of the viruses that will be circulating this winter. And a way to make sure that you're not obviously exposed to COVID, because you still can catch it even if you're vaccinated, is to take those twice weekly lateral flow tests. Now, they're still freely available, either to be posted through your door or to be collected from a local site, and all of that information can be found on the council websites. Again, if you develop symptoms, and lots of people still do, you must isolate and go and get that PCR test. So that's from one of our main testing centres. And please feel free to use your face coverings when you're in crowded spaces. You've seen again this evening, because there's a group of staff together, we're doing it here. It's not required, but it's very sensible. So please feel free to do it. And I would encourage you, particularly as we start going back indoors, because the weather's turning, as we start thinking about Christmas shopping, that we start wearing that face covering again. And as always, the basics around hand hygiene and making sure that you're sanitising if you can't get your hands washed on a regular basis are really good practice. And they're good practice no matter what virus or communicable disease we're talking about. So please remain mindful of others. Their vulnerabilities aren't always visible. And obviously just look after yourself this winter.
Thank you, Lucy. So obviously we are still very much fighting this virus. This is a live pandemic, it is still ongoing. We have not beaten it yet, but by working together we can make a really big difference in our ongoing response to COVID. We've been working together with system partners, and this has been really important, and we absolutely could not have got to where we have without meeting together with partners across the system, by working together with general practice and with daily meetings. And those meetings were taking place 7 days a week at the beginning and have continued, and those continue to take place across the system. It was really important to coordinate patient care. This was a new disease. This was something we had never encountered before. We were all learning, we were all teaching each other, and there was really good communication that was going across the system as we all learned about this really, really frightening but actually fascinating disease with all sorts of different effects that affect the whole body. It was really important that we opened up a data share so that information could be shared across the system. And this is something we will rely on moving forwards, is that ability for information to be shared across the health and care system as well. Some practices were struggling, and we had one practice that had a particularly bad outbreak, and we did need to make sure that there were buddies so that patients could continue to be seen. And throughout the pandemic, it has been really important that patients can be seen when they need to be seen, and that other practices support each other. There's been a lot of learning, and a lot of information has been shared across all of the practices within Northamptonshire. We've had a lot of conversations across the system that didn't take place before COVID came, and so there's been a lot of conversations between GPs and local consultants, asking for information, asking for advice, trying to make sure that the risk to our patients was as little as possible, that people attended hospital when they had to, but where they could achieve that care remotely and close to their home, that's something that we managed to achieve. And we've had to adapt, and we've had to adapt really, really quickly. It was really important that we made sure that health facilities, and in particular GP waiting rooms, were not places where people caught COVID. And we had to adapt those premises to keep the patients safe, but also to keep the staff safe as well. It was really important that personal protective equipment was worn and was sourced, and that we made sure that all areas of the health system had access to that. And that's something that we coordinated here from the Clinical Commissioning Group, making sure that everybody was protected in the face of what was a very frightening disease, and continues to be very frightening to many of the members of our public, but also to our staff as well. Many of us had never undertaken video consultations, and very many people in the general public were not sure how to use the technology they had. And many of us were learning together, and so one of the things that I personally did as a GP as we went through this is we would teach each other how to use a video call, how to open text messages, how to do some of the things that for some of our population was very much new and is now extremely valued as part of normal general practice. It was particularly important to protect the vulnerable people within our society, and obviously those people who reside in care homes are vulnerable, and we learnt as this disease developed that the older you are and the more frail you are, that the more vulnerable you are. And so particularly people in care homes, we needed to make sure that they were safe, to do things remotely where it was appropriate to do that, to make sure that care home staff were protected and that other residents were protected as well. As soon as we had vaccination available, it was important that we had a team that went out to those care homes and made sure that they were the very first groups to receive vaccinations and to receive protection from COVID. And we followed national instructions. There have been times where those national instructions have changed, and we've tried to make sure that we are up to date at all times in order to protect our staff. Where it was possible to work from home, that was something that we did. Where we needed to see patients in person within institutions, that was also something that was possible, and home visits have continued where necessary throughout. We needed to make sure that our reception staff were protected within buildings, and a familiar sight now within shops is that there are screens and barriers, but that was something that was very new at the beginning of the outbreak in the spring of 2020, and all of those things needed to be put in place. We needed to make sure that staff were tested, and we needed to make sure that staff were isolated when required, both to protect their colleagues but also to protect the patients that they care for. And we were absolutely delighted to be at the forefront of the vaccination programme. We first started with the vaccination programme in December 2020. We have delivered over 1 million doses, and that continues to grow every week. And we now have a variety of different places where vaccinations can be received. Some of those are local vaccination sites, some of those are mass vaccination sites, hospital hubs, and also community pharmacies as well. And we know that although the vaccine is not perfect, it is the best thing that we have to avoid as many hospitalisations and as many sad and untimely deaths as possible. And it is something that we are absolutely promoting in order to make sure that our population has the very best protection. 70% of those vaccines have been delivered in general practice, and we are really grateful to our GPs, but also to the volunteers and the many other disciplines of staff that have absolutely stepped up. We could not have delivered the vaccination programme that we've had without a whole host of people working together as part of a system. As Toby has mentioned, this is something where we all needed to work together to make sure that our population had the very best care and the very best protection that we could offer them. I'm going to hand over now to my colleagues, Dr. Naomi Caldwell and Dr. Sanjay Gardia, just to tell us a little bit more about how general practice has adapted. Thank you.
Hello, good evening everybody. My name's Naomi Caldwell. I'm a GP in Northampton, and I'm here to talk to you a bit about how GP practices have adapted to the pandemic and some of the challenges that we've faced. So the challenges that GPs faced were numerous and many. These are just a few of them. The first one being the national directive to undertake remote consultations where possible, but to continue to offer face-to-face appointments as required clinically. This caused an overnight change really in general practice, where we suddenly needed to adapt our technologies, the way in which we worked, and the whole face of general practice changed while we continue to provide safe care for patients, but also to keep our staff safe too. One of the other challenges was continuing to provide care for patients with long-term conditions, and we continue to do that throughout the pandemic, but again embracing different ways in terms of doing that via telephone, video, text consultations. We were asked to compile a list of shielded patients with some information from the government, but also with our knowledge of our practice lists. And we set about doing that and then contacting those patients as the most vulnerable in our community, ensure that they were well cared for from both a medical but also a social perspective. As Jo's mentioned, there was a whole new disease to learn about. We needed to keep up with constantly changing guidance, be able to reassure patients, but also know when to treat patients and when to escalate that treatment. We now also know about long COVID and the challenges around diagnosing that and support for patients. We continue to deliver vaccination programmes, and that included the flu vaccination programme. There was also the challenge of the COVID vaccination programme, and screening continued throughout the pandemic. So, how was general practice adapted? Again, there's numerous ways, and people have already alluded to some of them. Firstly, we looked at very different ways of consulting with patients over the last 18 months. We have always done telephone calls, but these increased in volume, and we started to use telephone calls for very different ways, which we hadn't done before. We now text patients. Patients are able to text things back to us, including pictures of rashes, but we can also attach documents to those texts to send things like sick notes to patients to reduce the footfall in practice. We've embraced video consultations. It's something, again, that happened overnight, but it is incredibly useful, and particularly, as Jo has said, for people who are carers, for people with young children, and has really changed the way in which we interact with patients. We continue to support patients with their long-term conditions in their homes. So that's supporting people with diabetes, COPD, and often these are the patients that are most vulnerable to COVID. So it was very, very important to continue that care to ensure that we gave people the best possible protection. We've talked about buddying arrangements. Practices set up different zones within their buildings, often a hot zone and a cold zone, but also practices set up a hot practice and a cold practice so that patients were kept separate. Those with COVID or worrying symptoms were seen on one site, and routine things like leg dressings or blood taking procedures were done on another site. We made contact with our shielded patients on a regular basis. We provided, again, safe areas for those patients to come in to be seen, but also to have blood tests and other investigations. So patients could still access face-to-face care when they needed it. We set up a home visiting service. We did this because we were aware that there would be patients at home who were unable to travel to the surgery, but also patients with COVID that we did not want to bring into the surgery. And these may have been patients who were unwell with COVID, but also patients who were COVID positive who had another clinical condition that needed to be reviewed. We worked very closely with paramedics who would go out and essentially be the eyes and ears of general practice. They would contact the GP or clinician back at the surgery, and we would agree a care plan. We set up hot hubs. These were maybe practices working together. In Northampton, it was a whole group of practices. The hot hub was on a separate site at the University of Northampton. Any patients who we were worried may have COVID and needed additional clinical assessment would go to the hot site and be seen by members of the primary care team, either then to be sent home with advice or, if necessary and there were concerns, to be admitted to hospital. We adapted our vaccination programme. Particularly flu was the biggest uptake there has been to date. We incorporated a new cohort, so we also vaccinated 50 plus, which we had not done before, and we continue to deliver the screening programmes. At the beginning of COVID, we also extended our access, and general practice was open for additional time over Easter and bank holidays. Where are we now? I'm now going to hand over to my colleague Sanjay to talk through.
Thank you, Naomi. So where are we now? We hear a lot about returning to normal, but to be honest, I think primary care is entering a new normal. Things have accelerated over the last few months, which would have normally taken a few years to do. We've already heard about all the new ways of consulting that we've started using, and I think that's something that we're going to have to adapt as we go forward. As we came out of lockdown in May, we were expecting patient numbers to increase. I think what we didn't expect is the level and the volume of patients that were requiring our help when lockdown first occurred. And we all experienced approximately about 25% increase in the number of calls that we were receiving. And that seemed to happen overnight and very quickly. However, general practice adapted, changed the way they were managing things to try and help all the patients as best as they could. At the moment, things are still very busy, and we're trying to manage that. And just as an example, on average per day, general practice is having 17,000 appointments, and out of these, we are seeing about 10,500 patients face to face. So you can see the volumes are quite large. If you take that to a month, we're seeing approximately 157,000 telephone consultations per month, and video consultation use has just shot up, and we're doing approximately 48,000 video consults through the year, which, if you look at pre-COVID, where we weren't really using video technology, is a massive jump. And we can hear from colleagues the amount of learning they've had to do to adapt to these new ways, but also for patients, how they've had to adapt to accessing healthcare. I think the other point we have to look at when we're looking at different consultation types is, as we move forward, we hear more and more about patients wanting face-to-face appointments, and absolutely, where these are needed, we will always provide these. However, we're also seeing the opposite of this, where some patients are embracing the new forms of consultation and they're not wanting to come into the practice. They're wanting to have more telephone consultations, they're wanting to have consultations over the video, or using our digital platforms to access advice or healthcare. So we're trying to go into a new normal, I would say, where we can embrace all of these to try and help patients in the easiest ways for them to access healthcare. Looking ahead, well, there's lots of things happening at the moment. If we look at vaccination programs, and COVID boosters are the talk at the moment, and also vaccinations for youngsters. However, alongside that, we're also looking at the flu program and how we're going to deliver that throughout to all our patients. And as you'll see this year, like last year, it's extended to over 50s. So that means we've got a large population. So we're managing that. And we're also trying to make sure that everyone can receive those in a timely fashion. As the NHS restores, and you've heard about the backlog that we're working through and our colleagues in secondary care are managing, we're trying to support our patients to help them not only manage their conditions for longer until they're seen for that definitive treatment, but also to help reassure them and manage any anxieties or worries they may have. And that's really important, because when they've been waiting a long time, having somebody to talk to and talk through these things is what's needed right now. Alongside this, you'll have seen a lot of things in the news recently about the refugee resettlement programme. And when this occurred, the pace of it was very rapid. We could see it happening on the news, and locally we had practices step up to provide both reactive care to these patients who are coming into the country, but also try and help with immunisations for these patients, screening, getting them into the healthcare system so they could access everything that they needed. Also, alongside this, you'll have heard my colleagues talk about the increased teams within primary care. So in primary care, in general practice, we as GPs, we work alongside great clinical and non-clinical members of our teams, and these numbers have expanded. What that does mean is, though, as our teams have expanded, our buildings aren't expanding quick enough. So we've had to look at innovative ways to try and do this, and also look at where we are providing general practice as to how we can best utilise the buildings to make sure not only that we have the space and facilities to be able to provide the care, but also to make sure it's safe for patients to flow through the buildings and to maintain social distancing and everyone, to keep everyone safe, not only our patients but our staff as well. I think lastly, on behalf of primary care, I'd like to say a big thank you. I think our patients and public have reacted amazingly to the changes that we've had to make in seeing them. There's been a lot of understanding and flexibility as we've had to adapt to the way we work to fit in with national guidance, and also to make sure that things can occur safely. We appreciate there's always going to be fears and worries when these changes occur, but in general, we've had great support. I think a big shout to our staff. Our staff have been phenomenal. They've gone above and beyond what was asked of them, and this was during a time when people were afraid. We didn't really know everything that we do know now about COVID, and they were working under increased pressure. Unfortunately, despite this, they do still suffer abuse at times from the public, and this can be in the form of social media or in person. So our big plea to everyone out there is, please continue to be patient, be kind, and just be respectful to all our staff. And a thank you to you all for coming on this journey with us. Thank you.
Thank you, Sanjay. Thank you, Naomi. Much appreciated. Next item we have is our financial update, always the highlight of any AGM, and we have the fabulous Stuart Rees to present that to us. Thank you.
Thank you, Joe. Obviously, we're going to talk about finances, but first, I'd like to say, before I go into the finances, that you've heard tonight how well the NHS has done, and particularly in Northamptonshire, and all things that have been taken forward, as well as coping with COVID. So, within this, we have to talk about the finances, the resources. They are limited. It's taxpayers' money. So tonight I will tell you how we did last year in 2020-21, and a little bit about what's going forward and how we spent that money. And did we stick with our financial duties and envelopes? So, hearing all you've heard tonight, the achievements, did we achieve our statutory duties and obligations? Yes, we did. We have £1,197 million to spend on the population for healthcare in Northamptonshire. We have to stay within that resource limit. We did. We're not supposed to make huge surpluses, so as you can see, 0.66 of a million within that target. So that is excellent. I'll bring on to how much. It sounds a lot of money, but I'll come back to that. We also have a duty to stick within our revenue admin, the running costs for the CCG. 13.9 million. Yes, we did that. We spent 11.6 million. We are meant to make sure cash flow works for not just in the health, but outside of the health. So we have a requirement to hit 95% of non-NHS invoices are paid within 30 days to have the cash flow for the system. Quite an important task outside. We achieved 99.76%. So we held and paid our invoices very timely. We have to stay in our cash resource limit. Again, we achieved that. At year end, we had just 2.1 million left in the bank. Of that 1,197 million, just 2 million left. Sounds quite tight, but we'll manage as we do. How did we spend that money? The majority of the money is spent in our acute sector at 54%. That would equate to about 648 million. So that gives you an equate where we spend it. And it very breaks down. So primary care, mental health, community services, and we have a very small bit that goes into very little things, other programs of 0.4%. How that is spent, this is important. Everything you've heard tonight, that is actually only £1,556 per head of population. So everything you've heard tonight was achieved with that per person for Northamptonshire and for the whole population. That's pretty impressive. So we have to give big congratulations. That's what people are doing in this county. That level of funding, that is very well done. They don't hear me telling them that very often, but they are doing very well. And so we keep it. So, just a bit about the future. At month 4, this year, we have split nationally into 2 halves. They call it H1, the first half of the financial year, H2 for the second half of the year. We haven't received our allocations. We should be getting that in the next couple of weeks. But for H1, again, we're managing within these resources and we are on plan to achieve it as a CCG. So at this point, I would say well done to everybody and how well we're using the resources in Northamptonshire. And I'll stop at that point. Thank you.
Thank you, Stuart, much appreciated. So what we've got now is we've got a film a little bit about supporting our local population. We are obviously so much more than just the CCG and the GP services. There is a whole range of health and care services, voluntary care sector as well. And this is about how the county works together to help our population to stay well. Hope you enjoyed the film.
The demand for mental health services in Northamptonshire has both grown, but it's also changed. So we've seen an 82% increase in our use of crisis cafes, an 86% increase in the use of our crisis houses, but we've also seen a 27% increase in the number of people being admitted for inpatient mental health care. And we've seen a 110% increase in people being referred with a first episode of psychosis. There's no doubt that the need for mental health support has increased, but the way it's changed is that people are coming forward with greater levels of acuity and severity and complexity, and that's changed the way we have to work together to be able to respond to those needs. We were quite fortunate in the sense that we've been planning an integrated response hub for some time, and we managed to get that to go live in March 2020 before the first lockdown. And this 24-hour phone line has been taking up to 400 calls a day, and it's been providing immediate advice and guidance and support. It can provide immediate access to mental health crisis services, but it can also help direct people's referrals and concerns to the right point in our system as quickly as possible. On top of that, we've also increased access to psychological therapies for mild to moderate mental health issues, and this included options for online and digital cognitive behavioural therapy. We're mobilising psychological therapies to be embedded in long-term physical health condition pathways. We're increasing financial resource to our third sector and to specialist services such as eating disorders and psychosis services, as well as putting more resource for psychology in inpatient mental health environments and increasing resource for psychiatric intensive care. The Crisis Cafe, the Crisis House and the Integrated Response Hub all involve a multidisciplinary team of third sector partners, clinical partners and sometimes local authority partners as well, working together to be able to meet those needs.
Well, the ICANN programme, Integrated Care across Northamptonshire, is a system-wide partnership transformation programme that's looking to better support people who are frail, whether they're living in their own homes or other settings. Some of the aims and objectives of the programme are to, I suppose, identify people sooner in that journey and to support them better and quicker than we've done as a system in the past. Key to it is working in integrated ways, so there's significant partnerships across the statutory and voluntary sector that will help us to do that, and what's been really pleasing as well is how we've been able to involve patients and carers in co-producing some of our early services in this area. There's lots of strain on health and social care in terms of demand on acute hospitals and frontline services. So we're hoping that working in this more early identification, preventative way to help people live well and age well will be really beneficial. One of the areas that's been really helpful in this is we have an excellent people advisory group made up of patients and carers, and they've been invaluable really in helping us to shape services and also reality checking what we're doing to make sure that that is the right things. So we've got welfare support teams that will be based around primary care networks, so there'll be one of those in every area of Northamptonshire. We're also starting our first dementia hubs shortly, the first one being in Corby, and there's other exciting work on the dementia pathway, and we're also helping to deal with some of the backlogs that have built up in the systems during the COVID pandemic. We've also started the county-wide Befriending at Scale programme as well, which is supported via coordinators and volunteers, and that's already dealing with good volumes of people and will continue to grow over the next months.
The idea of an annual health check is that everybody with a learning disability from 14 years and upwards starts integrating with their GP surgeries, having their physical and mental health checked, and then having a health action plan that actually starts to integrate them into other systems such as screening for cancer, screening for dementia, etc. So it's to actually make sure they're accessing the same health as you or I would. Last year, the pandemic, we realised there was a problem. We were halfway through the year and we'd only managed 5%. We'd never been in that position before, and recognised that we needed a system-wide response to bring us back on track and help us reach
at least 67%.
In addition to people being fearful to going into surgeries, obviously also GP surgeries were overwhelmed with the COVID pandemic. Northamptonshire Healthcare Foundation Trust and the CCG worked together to set up to support the GP system that we knew was struggling. The first thing that happened was nationally we all fought quite hard to allow for the 1 year only for a virtual check to be done and a pre-questionnaire that would help people prepare for that virtual health check. That really increased numbers. The GPs also really wanted to address the seriousness of having low rates, so they started to really put a lot of resources into the annual health checks. And also Northamptonshire Healthcare Foundation Trust started to reach out to those people that perhaps traditionally weren't going to the surgeries or were still fearful to have their virtual checks, and they were offered health checks at home, which really is the situation for a lot of people. We also wanted to get a lot of publication and media out there about annual health checks, so we applied and won some funding for actually getting our Voluntary Impact Northamptonshire and our Parents Carers Association to actually do a lot of media work. So in addition to everybody upping resources to try and get the checks done, we had a lot of media going out there, and that really helped. And so actually, although we were meant to achieve 69%, we really came out on top, achieving 77%, which was fantastic for us and for our population.
Social prescribing offers the kind of help that doesn't come in a tube or a bottle. It will provide an increasingly important non-clinical means to address our population's social, economic and environmental needs in a more holistic way. People will be offered the support and advice necessary for them to gain a greater level of management and control over their medical conditions. Social prescribing starts with a conversation, in our service with a link worker, experienced in listening, empathy and helping an individual to identify the motivation to make lifestyle changes. Our service will be focused on those with greatest need and likelihood of benefiting, thus going some way towards reducing health inequalities within our county. People living with long-term conditions, mental health and well-being issues, and or living in social isolation. We believe that social prescribing will ultimately reduce demand on higher cost clinical health and care interventions. At the heart of our link worker-led service will be a personal consultation and motivational interview. As a result, the individual will develop a personalised support plan, and the link worker will help in accessing whatever is needed, be it community groups, activities or clubs, legal or money advice, befriending, information and guidance. It is our objective to build sustainability and resilience in our communities and the VCSE sector through developing county-wide collaborative services that operate consistently and at scale.
So I was working in community pharmacy. I've been doing that for a number of years, and I was given the opportunity to come here at the vaccination centre, and I decided to make the move and help out during the pandemic. At the vaccination centre, so every morning I come here, I set up the whole the pods in the pharmacy. So I record the fridge logs, room temperatures, sanitise the surfaces, and then I get my files out, place them on trays. I have audit logs of everything of what is taken out from the fridge, placed on the bench for the vaccinators to come in and book out the vaccines, administer them to the patients and bring them back in and make sure they're recording each dose. Yeah, it's been really good, it has, because I've got to meet different healthcare professionals from different backgrounds. So I'm working really closely with doctors, pharmacists, nurses who are specialised in different areas. So it's been really good just to have conversations with them. I've met some amazing people here at the vaccination centre, and we're just glad that we've managed to vaccinate hundreds and thousands of people at Northamptonshire, because we've received our badges to confirm it.
Taken on quite a lot more face-to-face consultations with patients during the course of the outbreak. As well as that, We've had to arrange a lot more deliveries to patients to help with the isolation efforts, and we've coordinated with different agencies who have been volunteers from Northampton Fire and Rescue Service, the Northampton Advanced Motorcycle Unit called Farmer Bikes. We've had to do a lot of coordination for the delivery efforts because we normally deliver around about 70 patients worth of medicines per day, but during the pandemic we've done somewhere in the region of 150 up to 200 a day on some occasions, and the additional workload to get medicines to people's houses has been a major undertaking.
Thank you to everybody who's been involved in creating that film. I hope that you enjoyed it, and I certainly think that that's a very informative piece of information for us. Our next speaker is Naomi Eisenstadt. I'm delighted to introduce her. She is our Integrated Care Board Designate Chair and is going to tell us a little bit about the future. Welcome, Naomi.
Thanks very much, Joe, and thank you for the film, because I learned so much more about what we're doing. And unfortunately, I took this role as chair of the integrated care system a year ago and haven't had an opportunity, as I would have wanted to go around the county and see all this amazing work because of COVID. So it was very good for me to hear so much about it. What is an integrated care board? Well, we were set up as an integrated care system in April 2021. There are 42 ICSs around England, and what really we're trying to do in integrated care systems is hardwire into the systems all the kind of cooperative arrangements that you just heard about in the film, and make sure, rather than they be innovative, exciting new projects, they just become the way we normally work. So what is integrated care about? Well, the government tells us that it has 4 key aims. And I want to spend a little time on the aims because it's part of why I was so interested in taking on this role. One of them is improving outcomes for local people and patients, improving health and care outcomes for everybody. The second one is tackling health inequalities. And this is the one that is very, very important in terms of what I think we need to do. Because Northamptonshire is a very, very good area to live. It has lots of beautiful houses and beautiful spaces. But there's also some people for whom healthcare is not achieving what it should do as it does for the rest of the population. And we want to even out some of those unequal outcomes for people in Northamptonshire. Making best use of health and care resources is obvious. It's, as Stuart told us, it's taxpayers' money. It's your money. We want to make sure it's used to the best effect. And strengthen contribution to local communities. And I think, again, this is one that's very exciting and that I haven't seen in the past. And what that means is the National Health Service is a very, very big employer. And as an employer, we want to make sure that we're paying everyone a living wage. We want to make sure that we're providing apprenticeships for young people. We want to make sure that we're linking in with Northamptonshire University and FE education systems to make sure that the economy of Northamptonshire grows and we as an employer provide support within that economy. It's also about the use of our public spaces, the estates we have, how we can sweat the asset of the NHS wider than just health and care services. We're building on the long-term plan of the NHS and trying to push further the kinds of systems working that we just heard about in terms of COVID. Moving to greater collaboration, not competition. I have to say, when I took the job, I thought it was about making sure that the National Health Service and local government services work well together. But it's also about making sure that within the National Health Service, our hospitals, our GPs, our community services don't compete with one another, but work together to make the best smooth services for our public. I think it's important to note in terms of the film that every one of us at some point in our lives uses public services. All of us at some point use health services. Some of us have children, our children use education services. Some of us have a family member or ourselves who have a mental health problem and need more intense treatment. But the point is that none of us uses one service only. All of us at some point use some combination of services. And the whole point of ICS is about integrated care, is making sure those services work together. We have all had the experience of fragmentation, but we want to make sure as much as possible we break down the barriers, break down the silos, and stop the fragmentation and work together. Our roadmap is that we started as a sustainability and transformation partnership. Well, that's one that rolls off the tongue, isn't it? We all know what they are. In March 2016. By 2018, ICSs were beginning to emerge. We were developing an ICS in July 2020 and became an ICS in April 2021. By April 2022, we will be a thriving integrated care system. But more importantly, by April 22, we will become a statutory organization, which means that we will hold statutory responsibility, legal responsibility for the kind of public money that Stuart talked to you about, which creates a very, very different animal, really. It means that we are responsible to the public for the use of public money, and we'll do that through a chief executive who is called the accounting officer for that money, which means he is held to account, or she is held to account, for the use of that money. The structure of the ICS has two key components: an integrated care systems partnership and an integrated care board. The partnership should be an equal partnership between the NHS and local government, and it sets the ambition and purpose. It sets the priorities and the outcomes and an overarching integrated care strategy. Basically, if all the key partners in delivering for Northamptonshire agree on what the key priorities and outcomes should be, we are signed up to working together. The Integrated Care Board is a smaller group that binds together the partner organizations within the NHS and local government. Basically, it binds together those organizations with a statutory responsibility and the accounting officer role for public money. Our areas of focus will be place. So the ICS incorporates both North Northamptonshire and West Northamptonshire, and each of those will be operating services at place level, but also at sub-place level, which is primary care networks, groups of GP practices. And again, I would say that for Northamptonshire, sub-place is where we will find the most serious health inequalities and where we really have to have granular data on where people with the most needs live and how we make sure people with the most needs get the most services. Sometimes it doesn't work that way. We also have 4 key priority areas that we're designing into collaboratives: children and young people, mental health, ICANN, which you've already heard about, and elective. And obviously, via COVID, there is much to catch up in terms of elective care, particularly in terms of our acute system, our hospitals. Well, what really matters is that you get the health services that you need, the social care services that you need, and that you have a role in telling service providers what you need, why you need it, how you think it should be delivered. That doesn't mean that everybody can have everything that they want, but it means that we will do better for you if we understand and hear from you. I'm delighted to take on this role, somewhat challenged by it, but I think with your help in telling us what you would like out of a health and care system, we can do better for the people of Northamptonshire. Thank you very much.
Thank you, Naomi, and thank you for sharing your thoughts and your vision for the future. I'd also like to thank those members of the public who have kindly submitted questions, and some of these have come in during the meeting, and some of you took the opportunity to submit these in advance. And I'm going to be inviting up a number of my colleagues to help us to answer these questions, which I think will be of interest to those who are listening. So the first person I'm going to ask up to assist me with the answer to the question is our lay member for public and patient involvement, who is Bev Messenger. Welcome.
Thank you.
So the first question that we've received is, what is the current policy of the CCG for patient and public involvement, and what arrangements will be made to ensure involvement during the coming year?
Okay. Thanks, Jo, and thanks for the question. As you'll appreciate, it's been very difficult to continue some of our face-to-face activities during the pandemic. However, I'd like to reassure people that the CCG takes the engagement of members of the public very seriously, and I do personally as the lay member for patient and public involvement, in respect particularly around service changes. Unfortunately, at the beginning of the pandemic, we had to temporarily stand down the local engagement groups whilst we responded to the needs of the population for COVID-19. However, during this time, I can confirm that we continue to engage with the population in specific areas as appropriate on service changes. And to quote some examples of that, working in partnership with the County Council to carry out a large-scale engagement campaign for children and young people, and providing members of the public with an opportunity to give us the views and experiences of nursing homes. So our approach to public and patient engagement continues to be to engage with the local population, specifically in areas of service change, and we'll want that obviously to continue in the future.
Thank you very much. We have received another question which falls into the area that you are responsible for. So the next question we've had is, why the complete shutdown of communication? I find this not only disappointing but also disrespectful.
Well, if that's been what somebody's experienced, can only apologise. It's not been intended to be disrespectful. As I said in my previous response, it's been very disappointing for us to have to step down our engagement in response to COVID-19. And we had to make that very difficult decision, but it was in line with national guidance. And I'm sure, as I've already said, you could understand the pressures the services were under and dealing with the COVID pandemic, and therefore that was the top priority. So we took a far more targeted approach rather than our generic communications and engagements that we do on a normal basis. We specifically looked at service changes and how people were impacted, and we'll continue to do that for the foreseeable future. I think looking forward, what the ICS gives us is an opportunity to review all of our communication and engagement with our partners and make sure that that's fully embedded, and we will learn from everything we've done through COVID-19 and the experiences that we've had, and hopefully that will make the service stronger in the future.
Thank you very much for your time. Really appreciate it. Thank you. So the next question that we've received was, good evening. With the ongoing pressures on Kettering General Hospital A&E, where patients would have to wait up to 6 hours to be seen, would an evening GP surgery take some of the pressure off the A&E department? And Naomi Caldwell has come up to answer that question.
Thank you, Jo. Again, very good question, and thank you for posing that. Yes, I guess we can say GP appointments are always wanted and needed. However, there are a number of options for patients out of hours. There are a couple of schemes, one known as extended hours, one known as extended access. These offer appointments out of hours, so between after the hours of 6:30 in the evening, also over weekends. They can be accessed by phoning your GP surgery, who can book you into those appointments. They may be with your own GP or your own surgery, but they may be with other clinicians. In addition, we also have online consultations now. These can be filled out at any time of the day for some people, so they could be filled out in an evening, which would then prompt the surgery to call you the next day and offer an appointment, and again can be filled out over the weekends. So again, a very good question. I think in summary, yes, we could always do with more, but there are services out there for patients out of hours, and we are working really hard over the coming months to bring all of those services together so that there is a more streamlined approach to services, routine services for patients outside of normal working hours, and hopefully to reduce the pressures on A&E that we all know are real and present at the moment.
Thank you.
Thank you.
And I think in addition to that, obviously we continue to have Corby Urgent Care Centre and the out-of-hours GP service as well. So there are unscheduled as well as the scheduled appointments that you've mentioned as well. So I think there's a whole range of services for our population when their normal GP surgery may be closed.
Absolutely. So there's acute services, but there's also the routine stuff as well. Yeah, absolutely. Thank you.
So the next question that we've had is about prescribing. So we've been asked, why are patients that previously received B12 injections now being prescribed supplements? I've seen deterioration in a few friends, but I'm sure there are more suffering in silence. And I'd like to introduce my GP board colleague, Dr. Chris Ellis, who is a GP in Wellingborough, to give us the response to that question.
Thank you very much. Good evening to everyone watching live, in a manner of speaking. B12 injections are usually done approximately every 10 to 12 weeks with one of the members of the clinical staff, usually a practice nurse. The idea of an early lockdown was to actually try and reduce footfall within the general practice, particularly since these are relatively well patients and we don't want to bring well patients into potentially unwell settings, in the manner of speaking. So that's what we did en masse, is to try and change injectable to oral tablets to keep patients safer. We followed national guidance on that matter, and we are now reviewing that situation based on the updating national guidance, whether it's absolutely safe to bring patients back into the practice to reinstate the previous processes.
Thank you very much, Chris. Much appreciated. Thank you. The next question is, given the very significant impact upon end-of-life care that COVID undoubtedly had, could you make a comment on the robustness of the end-of-life pathway strategy, how it has been sustained over the past year, and what investments are expected in the next year? And I'm delighted that Ange Dempsey, our chief nurse, has come to join me to talk about the answer to this question.
Yeah, thanks, Jo. And as we know, COVID's been a really sad time. It's been a very difficult time, and it wasn't without challenges. And we did at times really struggle at times because of capacity issues, but I think what we did do is work collaboratively together. So how we did address things was working really closely with our care homes, who were absolutely outstanding during COVID, and equally we are still in a pandemic, Jo, and they're working tirelessly to provide end-of-life care. We also worked very closely with our district nurses, and without them we just wouldn't have managed. They've been absolutely amazing. Our palliative care nurses, our palliative staff, and not forgetting ambulance staff, who have really worked tirelessly with us to make sure we get end-of-life services correct. What I would say is our strategy now, we are starting to look to the forward, and what we have done is we've just recruited 3 new members of staff. So we've got a programme manager starting 1st of October, focusing on end of life, also 2 new clinical leads, which is great for us. We've also got our strategy it's working. Obviously there's always improvements you can make, but I'm really pleased to say now it's part of the integrated care across Northamptonshire, so it's part of that work, and we've got Elaine Graves working with us on that. So we are hoping that we will learn from the past, because obviously there's always learning, isn't there? And hopefully we can provide end-of-life services that meet everyone's needs. Just to say also, Jo, in the pandemic, and since then we've seen a 17% increase in people wanting to die at home, which is what we want. We want people to have their preference of where they want to die. So obviously it's something we're focusing on. We've got extra resources coming in, so I'm delighted about that, and hopefully we will make sure everybody has the death that suits them and their family.
Thank you very much. Thank you. Do you want to? Oh, that's fine.
Oh, thank you.
Okay. And the final question that we had was, with pressure being felt in general practice to hospitals and care homes, how are the CCG ensuring that services are being run safely, ensuring organisations are working together and in the best interest of the public? And I'm going to give you the response to this one, is that we need to work together. So I meet regularly with the medical nurse directors across the system. We meet with leaders from social care and also with allied health professionals as well. And that's a meeting that is really important to talk about how we join up care. We don't have individual patients. This is our population. We serve you, we look after you, and we need to do that together, and we need to make sure that that care is really joined up. And so the way that we're going to do that is to continue those conversations, to continue to work together, and everything we do with the whole system working together across the health and care system, but also within NHS organisations. Those lines of communication have opened up through COVID. Those are something we will continue to do, and we will continue to care together to make sure that people get the very best care possible. So that is the end of the questions. We're just moving to the final item of this evening. I'm going to give Toby an opportunity to give his closing remarks, and then at the end of the event I will give mine. So do you want the podium?
Thank you, Joe, and thank you everyone who's joined us this evening for this session. I have to say, I've always enjoyed annual general meetings, and I've particularly enjoyed them because of the opportunity to meet and have conversations and interact with people, and I'm sure for you it's the same way for us. Tonight is not quite been like that, has it? And it was not able to work in quite that same way. But thank you for those of you who have kind of dialed in and watched. Thank you for the questions that you submitted. And I really, really hope very soon that we can get back into a space where we can physically be in the same room with many of you as well, and have some of those conversations in the same space, because I think we all know and find that they are. It's an easier interaction, and it's a more enjoyable conversation as we go through these things. But just a few sort of summary remarks from me, reflecting on this evening and reflecting on the year that we've had. I think what you've heard in so many different ways tonight is what we all know, which is we have, and the year we're reflecting on has been a genuinely, utterly unprecedented in any sense of the word. None of us could have anticipated or imagined the year that we've ended up living and working through. It's touched all of our lives, in many ways very tragically, in many ways very painfully and difficultly, both from our family, our friends, our loved ones, but also from the experiences a lot of us and our colleagues have worked through over the last year. And yet, out of that, I feel a real sense of optimism and of hope in terms of the way our teams have worked together. And I wanted to say a real thank you to all of the clinical and professional staff across health and care and the wider public sector and our voluntary sector across the county for the way people have come together in outstanding, difficult circumstances, but to pull together and support our population in a way that's really helped them at an hour of greatest need. And I know there is so much coming out of that we will take forward in terms of the things that many of our colleagues tonight have talked about, some of the things that in really short timescales we've become more innovative, we've implemented new ways of working, and there's lots of positives to that. But we also know that we've got a real challenge ahead in terms of the autumn and the winter that we're going into. As Lucy, our Director of Public Health, rightly reminded us, we're a long way from being out of this yet in terms of the challenges, the kind of COVID period we're still living and working through, and also those other pressures, seasonal flu and other things that will no doubt come along to present pressures on health and care services over the autumn-winter period. I'm confident and optimistic, though, that whatever comes our way, the strength of resilience we've seen from our staff over the last 18 months will carry us through this. And also, I think that the spirit and the approach and the resolve of our public, of all of you, of our population, in terms of the way that you've adapted and responded to things. So the final thing that I wanted to say was really a very personal thank you, actually, from me to all of the clinical commissioning group staff. We often talk about frontline staff working in other settings, in practices, in hospitals. But actually what you've heard tonight, I think, is the story of an organisation, a clinical commissioning group, which plays a role that is often not very well seen and as visible as some of the other roles within the NHS and the health and care sector. But what you've absolutely seen and heard is a really, really critical role, often kind of holding the ring, bringing people together, making sure that we've got plans that are coherent, that are lined up, that make sure that we're all pointing in the right direction. We know who's doing what across the county. And that was more than evident than ever over the last 12, 18 months. So a really sincere, heartfelt thank you from me to all of our staff, many of whom stepped into really, really different ways of working, different roles, working from home, not doing their normal day job, but going off and helping to run vaccination programs, some of them stepping back into clinical practice and working in different settings. Our comms and engagement teams having, as Bev was saying, to put down some of their normal work, but for really, really good reason, because I needed, and I think our population needed them to step over here and do the great job they've done through COVID in providing the public messaging and the information services that we have. So my final word to leave you all with tonight is a real thank you from me to all of the staff within the clinical commissioning group, all our member practices and all of our board members for the huge contribution they've made, Joe, to keeping our population safe and well over the last 12 months. Thank you all.
Okay, thank you. So thank you, Toby. Thank you for those final remarks. I've got very little to add to that other than to thank the team that have organised tonight, to all of you who made things possible, to those of you who are listening either live or on a recording on our website, and to thank you for everything you're doing and to wish you safe journeys. Stay safe, protect yourselves, protect those loved ones around you, and we look forward to seeing you next year. Thank you.